Sir, want to do that?
And this is Hannah. She's our new deputy clerk. I'm going to be helping her with today's meeting, and then I think she'll be taking over either this one or public safety. So.
And you're full-time now in the clerk's office? Give a little your resume, where are you from or anything?
Well, I live in Frederick. Used to work in Taylor's Falls before. So.
Welcome to Polk County. You'll probably be the chief clerk someday. That's usually the way up the ladder. Okay, relax.
Great compliment.
We'll start with the approval of the agenda.
Agenda?
Second.
Moved and seconded. All in favor, say aye.
Aye.
Carried unanimous. Disclosure, I don't think we have anything there. If there is, speak up. Chad, do we have anything under public comments?
And you missed the minutes, approval of minutes.
Did I miss that or is that coming up? Okay, yeah, number 3, approval of the minutes, March 16th, 2021.
I make a motion, we approve the minutes.
Motion by Supervisor Kelly,
Second.
second by Dr. Bill. All in favor, say aye. Aye. Carried. Now, public comment, Chad, any news there?
There's nobody online.
Okay. Moving right into, I think we have 3 or 4 presentations, Tanya said. So Tanya, I'll let you take over there.
Okay, well, first up, Bill had requested last fall, I think, to get these ladies on the agenda, and we finally got them worked in. So this is a presentation by Lee Wallen and Marissa Lindsay. They are in the Department of Children and Families unit. Marissa is the lead worker for our Children's Long-Term Support Services. So she'll be talking to you about Children's Long-Term Support Services. There's going to be a lot of C's referenced because most of our programs start with the letter C. And then also talk about transitioning and how we get kids connected to transitioning into adulthood. So if you guys want to go ahead and take it away.
Tanya, I'd like to say these presentations, we appreciate that very much. It gives everybody a broad understanding of really what's happening in your department and how we're servicing our people. I appreciate that a lot.
We're glad that they are good to present to you too. So
See if you want.
very knowledgeable.
So Lee is passing around essentially the paper copy of what I'm going to be talking about, so you guys can make notes, follow along, anything like that.
Miss Wallen.
As Tanya stated, my name is Marissa Lindsay, and I've been a social worker with Polk County Human Services for what will be 16 years in August of this year. The majority of those years have been working with one of the programs that I'm going to talk to you about today. Mr. Leva, who sits on our program advisory committee, which I will also talk about here in a few minutes, asked us to come and talk to you guys about the programs and services within our unit. So our unit that houses these programs that we work with is called the Family Services Unit within the Department of Children and Families. We work with the following programs, and here's where the acronyms come in. So bear with me. Children's Long-Term Support, Children's Community Options Program, Comprehensive Community Services, and Coordinated Services Teams Initiative. You'll notice that they each have an acronym: CLTS, CCOP, CCS, CSP, which is where Tanya stated we sometimes affectionately refer to these programs as the C's within the building. And then our unit as the C's. We do that because acronyms, let's be honest, can be kind of confusing and overwhelming, not only to us, but also to families and other people that don't necessarily know about the program. So what we do is we try to focus less on acronyms and more about what the programs do, which is help children and families. So I will talk a little bit more specifically about each of those programs in a couple minutes. But in the unit, we currently have 4 workers. So there's me, and I work with children that only require services from the Children's Long-Term Support Program. I have a full caseload. And then I'm also the lead social worker for these programs, which just means that I am the primary person that does a lot of administrative work for the programs, staffs, cases and different things like that with our other workers in the unit, and kind of just take care of all those extra things. We also have 3 social workers that carry a caseload of kids that are enrolled in both CCS and CLTS services. Next is program information specifically. I do have this broken out a little bit, so even though we don't like to focus on necessarily separate programs, just giving you a little description of each of them will help understand what they are. So the Wisconsin Children's Long-Term Support Waiver Program, otherwise known as CLTS, is a program that supports children with disabilities and their families through supports and services that help children grow and live their best lives in the home and community. Children enrolled in the program and their parents and/or caregivers work as part of a dedicated team who help them meet the family's and child's needs and goals. You'll notice that in each of these programs I'm going to talk about, team is kind of a major theme, and we'll talk about that more specifically. Comprehensive Community Services, otherwise known as CCF, is a program for adults and children that have mental health and/or substance abuse disorders, complex issues that interfere with major life activities, and who want to make changes in their life. CCS is a recovery and wellness-based program, so the premise is that people who are involved in this will make goals on things that they want to improve and then work on those therapeutic services. Coordinated Service Teams Initiative, otherwise known as CST. This is where the teaming part comes in. So teams are an important part of all of our programs. We welcome the child, family, natural supports, and any other providers to the same table. This helps for everybody to be on the same page, so to speak, in regards to supports and services and progress within the program. We all know that many families have lots of things going on in their lives, and especially kids that may have mental health concerns or disabilities. That gets even more challenging. So there might be schools that they're working with, clinics, therapists, psychiatrists, social workers, all sorts of different people, and it can become complex to manage all of these providers separately. So the process of teaming, bringing everybody to that same table, originated in the Coordinated Services Teams Initiative, which has been around for actually quite a long time. It was here when I started 16 years ago, and maybe has been around for even longer than that. But the philosophy of teaming is used for all kids who are enrolled in the coordinated or comprehensive community services. That teaming piece is an integral part in CCS. So again, I talked about having that recovery team where everybody that's involved in the child comes to the same table. The goal of having this is just to simplify things, have everybody be on the same page and monitor that progress. In addition to that, teaming is just not something that's important for these specific programs, but for any of our kids involved in any of our services in the building. So in 2021, the philosophy of having a team and the benefits of that will make its way to other units within the building. As we will be training staff in both youth justice and child protective services, how to incorporate the teaming model with families that they serve. Lee and I will be working on that some late summer and fall, where we will take the philosophy and the initiative of having these teams and information about that, and train other social workers in the building to employ those philosophies within the kids that they're working with. So all families, no matter what services that they are in, have the potential to benefit from having a team in place. That is forthcoming, and those social workers will be able to use that with the families that they're working with and get everybody on the same table for those for those kids as well. In summary about the programs, CCS and CLTS are similar in a lot of ways. The primary difference is that CCS is recovery oriented and focused on mental health. CLTS is for kids with disabilities, whether that be mental health, physical, or cognitive disabilities. In summary, the ultimate goal of both programs is to keep kids in their home and in their communities and to help them live their best lives possible. The rest of this information is just kind of how we get referrals, what eligibility is based on, and just a little bit of other statistics. So our referrals come from several different places. We get referrals from other social workers within the building. We get referrals from hospitals, clinics, counselors, psychiatrists, schools. Birth to 3, which is typically CLTS only, that we get referrals for. Child Protective Services and Youth Justice. So they come from all over the place. Eligibility is based on meeting a functional requirement through a functional screening process. So this is actually a pretty comprehensive process. And it pulls information from parents, school, medical records, any of the services that they've been involved with. We take all that information and put that into a screening system, which shows us whether they're functionally eligible for the program. In order to be on these programs, CCS and CLTS, they have to have a source of Medicaid. For CCS, specifically, they have to have a mental health and or substance use disorder. And then for CST, that coordinated service team, there's no financial eligibility requirement for that. I put in just a little bit of information about funding. I thought that would be something that the board might be interested in. So for children's long-term support programming, funding is actually all state level funding right now. So no local dollars are used for services. The state funds all of those services. And that is recent as of January 1st. CCS funding is a little bit more complicated. And I don't know the specifics of that, but if there's questions about that, perhaps Tanya and or Lisa or Lee might be able to answer that. I know it's 100% funded, but I think there's some complexities in regards to where it's coming out of initially. I did throw in some examples of services so that you guys could kind of just have an idea in your head of what types of things that we are able to cover. For CLTS, it can be things like respite, home modifications for kids with physical disabilities, special needs camps, safety systems for children that might wander, adaptive bikes, van lifts, communication aids, fences for safety, and items that help with sensory needs. This is not all inclusive, but just kind of a general example. For CCS, again, that's more mental health-based services. And so some examples of things that have been covered under that are peer support, mentoring, life skills training, stress reducing alternative care options such as meditation, exercise, equine therapy, which is horse therapy, climate skills development, counseling. Again, not all inclusive, but just kind of a general idea. We coordinate with a lot of other people inside our building and also outside of our building. So we work closely with the ADRC. The ADRC is like the one-stop shop for people who are transitioning and for adults age 18 and above. So when we have kids on our caseload that are turning 18, we work very closely with the ADRC to transition to adult services. We do this as seamlessly as possible so that they don't have a gap in services or lose any services. We also work with Youth Justice and Child Protective Services. There's a good handful of our kids that we work with that may also have a worker with one of these units. I work very closely with birth to 3, and we receive lots of referrals for birth to 3. Probably half. For when the child is turning 3 and moving out of the program, but still need continued support. We work closely with economic support in regards to Medicaid issues for consumers. And then also we work closely with the fiscal department in regards to budgets for the program, ordering supports and services, authorizations for services, and all of this fiscal related. Coordination with others outside of our building includes any people that are on any of our teams, right? So it may be working with hospitals, therapists, psychiatrists, medical doctors, schools, service providers that are set up through CCS and CLTS programs. Nearing the end here, I do want to talk about our CST, CCOP, CLTS Birth to 3 Advisory Committee. So again, all of those acronyms. CST program and CCOP are required to have an advisory committee with membership requirements that are based in statute. However, we see the benefit of having an advisory committee for all of the programs, and so have included CLTS and Birth to 3 programs in the committee, even though it's not required. Current membership includes Unity School District representatives. Mr. Leva is on the board as well. Birth to 3 Early Intervention Coordinator. Department of Children and Families Director, the Law Enforcement Officer, which is the Unity School Resource Officer, LTS and CCS social workers. And then of the utmost importance, the board focuses really heavily on wanting parents that have, parents on the board that have children that are receiving services through our program. Because after all, the experts on what their kids need, how the programs are working, and how we can improve. We do have currently 2 parents that are on the board. We're always looking for more. And so we're kind of constantly looking at how we can expand the board and looking for additional members. The purpose of the advisory committee is to provide guidance in shaping programming. They hear updates in regards to the programs and improve plans as necessary. We just had one this morning, maybe quarterly. They are very important in helping us see different visions and look at different things in regards to different ideas for. I threw in a little bit of statistics here for the end. So in 2020, we had a total of 44 referrals. Those referrals, some of them went on to be enrolled. Some of them may have been referred to a different program. Some of them closed out for one reason or another. And then currently, as of today, we're serving 72 children on these programs. 36 of those children are receiving services through Children's Long-Term Support only. And then 36 of those children are receiving services through both the Comprehensive Community Services Program and the Children's Long-Term Support. And currently, we have 5 pending. So we are always busy processing referrals, enrolling children, and then managing their plans and services. So that is all I have for you. If you guys have any questions, read it out.
Any questions for our presenter?
Yes.
Sharon?
Is the caseload that each person has with this number of children, is that an adequate number of people? I mean, I don't know what's.
So that is a really good question. We've done some informal surveys of some, or I have done some informal surveys of some of our surrounding counties. And what I found was that for children that are on the Children's Long-Term Support Program only, The ideal case number ranges from 30 to 40, with 30 to 35 being most comfortable. And then for children who are on both comprehensive community services and the CLTS program, that ranged anywhere from 10 to 15 for children. So this unit only works with children, I should mention that, under the age of 18, was anywhere from 10 to 15, with 10 to 12 being. So when you look at caseload size, I mean, I think there's, there's ideal, right? Where you can probably do your best thorough work. I'm sure obviously we can always have a bunch of kids on our caseload and be working with them. But, in order to give the attention needed to those children, there's those ideal numbers. Currently, our workers, especially for those workers that house CLTS and CCS, have anywhere from 10 to 15 kids on their caseload. So, and it can be a lot of work depending on the complexity of cases, the level of mental health concerns, if there's crisis issues that the kids are often, experiencing. So it just depends, but those are some of those kind of ideal numbers.
First, let me just say thank you for this presentation, and it's nice to have that amazing comprehensive look at what you guys do. And oh my gosh, thank you for this work that you guys do in the field. And can you just go back? I might have missed this team piece. Did you say that in late summer, fall, you're going to sort of formalize that, or did I miss that?
We're going to expand that out. So coordinated service teams has been something that's been around for quite a few years. As long as I've been here, and maybe before. I should have looked at dates of that. So we've had the coordinated service teams initiative in the building in one way or another for all of these years. When we got CCS, because that teaming aspect is already an integral part of CCS with those recovery teams, we kind of integrated that into CCS. But we are going to be looking at expanding the concept of having teams and everybody being on the same table in late summer, fall to the other units within the building. So youth justice and child protective services. So we already have the program, but we're going to expand the philosophy into other units so that they can use it with their kids too.
Thank you so much for your extremely informative presentation.
John, there's another question.
John, just one comment here. Being a member of this team, and I want to use that team, I found that the people that are working, Marissa, Leah, and the social workers that are there, they're extremely dedicated. You can't believe the amount of time that they put in with these families and with these kids. And I'm not just speaking from the school point of view. I just know because I've worked with some of these families. So the staff is extremely dedicated. And you talk about kudos, they're caring, they're passionate for the things that they do. And I think this interacting team process that they do is extremely important. Sitting down with parents and sitting down with everybody that's involved in community services department is important, because you can't believe the puzzle pieces that go together to connect everybody from this building over to the other building when they end up in court. The other thing that I think that is extremely positive for this group is the parents that are involved in this advisory group. I haven't heard anything other than positive comments from those parents that come into these meetings and say how dedicated the staff is, and they're very supportive of the support and positive outlook that these workers give their kids. And I have to say that because I've been on this board, I think for, 5 years, give or take 12. And it's important that they get the kudos, because they don't get the forefront all the time.
And I think it's a true expression of the success that teamwork brings seems to be the key point in your, Tanya, you deserve a lot of credit for spearheading the teamwork attitude. Would you introduce yourself and tell us about your years of service to our people? It's certainly outstanding.
Yes, yeah. So again, Marissa Lindsay. I've been a social worker here with Polk County for what will be 16 years in August. And the majority of those years have been working with the Children's Long-Term Support Program. For the first maybe 2 years, I actually worked with what was called juvenile justice and is now called youth justice. My degree is in social work and I'm a certified social worker. So I have been here working with children's long-term support for a very long time. And it's been a joy to work with these families. It's nice to be able to help families get what they need. And I should mention too, which is important, the goal of the programs are to keep kids in their home and their community. So we hope that that if we have kids involved in these programming, we hope to keep them from having to go into a higher level of care of some sort. So that's the goal of these programs, is so that we can kids home with their families and in the community, and especially in regards to the CCS services, that mental health piece. We hope that having kind of those intensive services in the community will keep them from requiring any additional, placement of some sort in the future. So I hope it's more of a preventative sort of deal. So,
Do you have any idea, like in 2020, how many moms your Birth to 3 program serviced?
So Birth to 3 is probably like a whole entire another presentation. And actually, she just spoke, Dawn just spoke at our advisory committee this morning in regards to her numbers, which are a lot. And I cannot speak those to you because I don't remember. So they are also an extremely busy program. And it may be a benefit to, have them share their, but I cannot speak to that. I just know that.
But just an inspiration to know that rather than just we're working with troubled and middle, that we're there for the start for our people. Thank you.
Yeah.
One more question.
One more question. Do you also work together in helping the caregivers? Because the parents being caregivers sometimes need help too.
Yeah.
Is that part of the whole process, is making sure that they're in a good place too, to be able to provide the care their children need?
Yes, and so, for example, with children's long-term support, we provide services. One of them is respite, right? So which is giving the parent a break when they need it to refresh themselves, and so another caregiver might come in. Parents can go grocery shopping, or they can go take a nap, or they can, do the things that they need to do. So that's one of the services. And then for CCS, that mental health piece, there's things like parent support in regards to different kind of parent training, to help them respond to their kids in a different way that might be more beneficial. So yes, that's really the focus, is making sure that parents, it's not just getting kids services, but making sure that we're putting things in place that benefit the whole family.
Thanks again and congratulations.
I just want to add that Marissa became the lead worker for the Children's Long-Term Support Services about a year ago? June. And has just done a phenomenal job as far as supporting the staff, 3 social workers that she helps staff, and really making this program, all these programs come together in harmony and just with our numbers and budgeting. So it's been a real asset.
Thank you much.
Thank you.
Thank you. Thanks, ladies. Great job. Okay.
I will introduce Chad Polk. Chad's been with us before a few times. He's the director of child support. He was on our agenda last time just to give an update on child support. It didn't work out with the date changes and all, so we asked him to come today and give his update for you as part of our normal updates from child support.
Thanks, Tanya. Welcome, Chad.
Morning. I did hand out, I hope I hit everybody. If I did not, please let me know.
A little bit of resume, Chad. I think I remember when you were hired, but
So my name is Chad Polk. I've been with the county for 22 years, the entire time with the Child Support Agency. I started there as a financial specialist, which was a new position created back in 1999. I moved duties out of the clerk of courts entirely into the Child Support Agency. And so I worked in that role until about 4 years ago, where I kind of moved into like a lead program specialist and kind of lead worker move. And then I moved into interim director and became director 2 years ago at the end of February. So that's a little background as far as this is just listed on the agenda as kind of a quick update as far as how things are going. The handout that I gave you kind of gives you an overview as far as what the agency is, and so I'll kind of go over that and try and be quick here this morning. So our staff breakdown is we've got 6.6 FTEs that consist of myself as the director manager. We have 4 case specialists. We have 2 administrative support staff, which equal out to 1 FTE. It's 0.75 in the Child Support Agency, and then we've got the legal secretary from Corporation Counsel, which also helps us out, and that's at 0.2. And then for our legal counsel, we've got Malia and Joe, our Corporation Counsel and Assistant Corp Counsel, which equal out to be 0.6 FTEs for the agency. The program is mandated under the Title IVD of the Social Security Act. We call it the 4D program. And some of the things that we do is we help establish paternity for children who don't have paternity established. We establish and enforce and collect court orders for child support, medical support, and health insurance orders. We also assist other states in enforcing their orders. They will send stuff to us and say, we've got an individual who lives in your state, we need your help enforcing our court order. And so therefore we get it set up in our system and we help enforce and then send that money out to the other state to get to the parent that they have there. We also do collections on referrals that come over to our agency. So if a child is placed in long-term care through our human services area and economic support, we get a referral on our end, and then we would, if there's a child support order, we then redirect that child support order to help kind of recoup and collect some of those costs of foster care and kinship care and redirect that back. Just some quick performance numbers. As of the end of last month, our caseload is roughly 1,600. That turns out to be about 400 cases for each of our 4 case specialists. Our court order establishment rate last month was 81.3%. Our paternity establishment rate, we always kind of laugh about this. Our paternity establishment rate is 101%. I like to joke that we know who's going to be dad before he knows he's going to be dad. The reason for that is our performance numbers follow the federal fiscal calendar. And so it starts as of October 1st. For paternity, the denominator of the number of cases needing paternity is established on October 1st, and that never changes. So then during the year, as we get new paternity cases and we establish it, that numerator increases, and so therefore we can get over 100%. It's there's been years when we've had 123% paternity. So it's just kind of one of those numbers that's a little funny. Our current support collections rate as of the end of March was at 77.67%, and our arrears collection rate was 61.54. And that is a cumulative number that starts October 1st and then grows until September 30th at the end of the federal fiscal year. And so the goal on all of those is 80%, and that's set by the federal government. Except for paternity, which we shoot for 90%, which, as you can see, we're sitting over. And then just how does those percentages and collections break down into numbers? And on the second page here, I've got some statistics for the amount of money that has been collected and gone out to families, not only here in Polk County, but the way the program works, I kind of mentioned interstate orders. And so these numbers here reflect not only money that's collected and given to Polk County families, but everything that runs through Polk County Child Support Agency that we're enforcing and we're working. It would go out to other states and even parents in other counties that we're enforcing orders. And so for the total year, calendar year of 2020, we collected over $3 million in current child support. And in arrears collection, we had over $1 million, just over, for a total of $4.3 million that was processed for cases that our agency handles and sent out. That second set of numbers there that says total for IVD and NIVD. So through our agency, we've got what we call our 4D caseload. And those are cases that our caseworkers actually enforce and deal with the parties and do the individual steps they need to do. We also have another set of cases called non-4D cases, which would be a court order that, let's say, a family gets divorced and there's been no application for our services and there's no help from economic support for any type of public benefits. Those cases are then entered by law into our system to track the funding or to track the payments and everything. But we have no enforcement action on them because they haven't asked for it and there's no requirement. So that is another set of cases kind of off to the side that our administrative staff has to enter in the system. We're there to answer questions. We can't give legal advice, but we're there to help get those payments processed and out to where they need to go. And so if we include those numbers as well, for 2020, there was a total of a 4D caseload and a non-4D caseload of 4.5 million. The arrears collected there were, again, just over $1 million, for a total of 5.6 million for the year 2020 for all the money that processed through our agency to get out for it. And then the last two kind of areas there are just from January through the end of March for 2021, kind of where we're sitting.
Well, Chad, that's quite a success story. I look at those numbers.
I
can
have a
just
question.
tell you I first got on the health and human, that was the name of it, 25 years ago, 96. And our child support person was our corp counsel. And so I'd go into his office prior to a board meeting and he'd give me some numbers. And at that time, to get child support, you could, there was a device, they could go to an employer, but employers, they were too anxious to really take out anything for child support. And then once the county went to a system where we accepted our credit card system and that, and enforcement came, now we have a terrific system and appreciate what you guys.
I have a question for you, Chad. Can you hear me?
Yes.
My name is Sabrina. I'm one of the board members. I wasn't able to be present today, but I just had a question in terms of the caseload. You said that there's 4 caseworkers and each have approximately 400 cases. How does that reflect their availability to respond or communicate with individuals that they're working with. Because I've received quite a bit of feedback over the past few months that there's been a lack of communication between caseworkers and families. And so I'm just wondering, is that reflected on because they're kind of overloaded in terms of their caseload, or what is the best way to maybe communicate that I can relay to families? Is email better to communicate with the caseworker, or is a phone call better? What is your feedback on that?
Thank you for that information. The caseload is about is fairly even for all the caseworkers. During these last couple months, not to make excuses for technology, but we've had updates in our office to the phone systems, and with we've been with COVID here for a year, and as far as accepting appointments at the office there, really I would say to leave a message, and I will have a discussion with our staff as far as trying to follow up and find out what they would prefer as the best method of following up with them. One of the things kind of during the last year when we ended up working remotely, at that time we didn't have ability to remotely receive our phone calls that come to our office phones. That has now changed. We've now got the ability, so if they call the main line, whether the worker is working in the office or they're working remotely, that same phone number would reach them remotely as well. So I appreciate the information that you've received and sharing that with me, and I'll follow up with the staff to try and get it resolved and get a timely response up to those parties.
Okay, sounds great. Thank you.
Yeah, thank you for this great update. And I'm curious on that same, can one caseworker carry a load of 400, and can two support counselors? Seems really high to me, but I don't know this world.
So the way that our agency is considered a medium sized county, and the caseworkers there handle about every aspect of the case that there is, from establishment to establishment of the court order, to the enforcement of that court order, the paternity side of things as well, and the interstate stuff. Really, the only part of the caseload that the caseworkers don't handle would be the entering of the orders and kind of the financial information. And myself and then the administrative staff do that. And I point that out because some of the larger counties, while their caseloads may be larger, they also kind of designate certain workers to work on like just interstate, or just what we would call intake and establishment. And so the size caseloads that we have, historically throughout the years, when I first started, I believe we had 6 caseworkers. And then through, some budget cuts and people moving to different areas, we just weren't able to fill a position. At this time, 400 is manageable. Again, it's just still kind of dealing with the changes that happened at this time last year. We all had our own routines and we were used to doing things. And, I think now that we've had a year of working, with COVID and the different changes we had to do that way, it's still manageable. I don't feel like it's too many. It's just making sure that we're kind of getting back in.
I want to make a comment to you on that and to the lady that called in. Once this COVID is over, I tend to have one meeting a year at our nursing home in Amory. And I'm going to tell you about a time we came last year. In fact, I came to the nursing home in Amory where we had our meeting. And there was all these butterflies and little things like that all over the walls. And there was in fact, there was 278 of them. And there was 2 caseworkers there. And those 2 caseworkers, that was the number that those 2 caseworkers were servicing. And these 2 gals gave a presentation on just an ordinary day that came up prior week. And they had got a call from the sheriff's department where they had to be at a drug arrest and take the 5 kids in, and another, there was a family that actually sent home from school with lice infection. And they had to take these kids and they had to buy all new clothes for them. Fortunately, there was a tunnel here between the old jail and that, a couple rooms. They had to be isolated. And these 2 caseworkers put in over 16 hours in that day. And both of them broke down and cried at that meeting at the what they had to do. So there was just a quick insight of the responsibility of some of these people that we can't even comprehend. And at our towns, at our county jury committee meeting, we talked about different caseloads around the county. And the consensus was that a caseworker should have really no more than 15 their agenda. And look what we have. And that's a result of budget cuts and things like that. That's tragic. Thank you. Appreciate your work, Chad. Outstanding commitment.
Are you comfortable with you and Joe's 1,500 kind of, is that a manageable number?
It is. The brilliant thing about the child support system is that so many things are automated. And every day, each child support specialist has a work list. So it's telling them, these are the cases where the kids graduating high school and emancipating, and you need to look at changing the order. Here's cases where it hasn't been looked at in a while, you need to check. Here's cases where payments aren't coming in all of a sudden. Let's figure out if the person still has that job. So they have an automated system that really clues them in. There are also reports that the specialists run that give them all sorts of data. And I can tell you that for years and years, we had staff that never had any turnover for a long, long time. It was like a honeymoon period. And everybody got to know their case loads. They got actually some personal relationships with their caseload, their families. They got to know them, know when things were happening and how to work with them. That's changed. I mean, we had a lot of retirements and some turnover. And so there's been new case workers being trained in. But there is a system where every time a phone call comes in and somebody leaves a voicemail, there's a note that's put in our system. So things don't generally fall through the cracks. So if there are families out there that are saying, we're not getting feedback, we do get a lot of folks that call. And if they don't get a live person, won't leave a voice message. And then they're saying, well, we can't ever get a hold of our worker. They have to leave voicemails right now because they're not going to always get somebody live on the other end of the phone. If they do leave a voicemail, they are going to get a return call. It might take a couple of days and the voicemails do get reviewed, but if people are leaving those voicemails, they are getting information back. It's one of the other things where too, generally nobody's happy. The parent that's paying thinks they're paying too much. The parent that's receiving doesn't think they're receiving enough. And we have just as many women ordered to pay child support on our caseload as men, nearly. And so it's not the old traditional, the father's paying the mother. It is all over the map. And actually, I think it's a little bit more difficult sometimes to have the mothers pay in. And so we're using the court system, we're using contempt, we're using jail as a way to enforce, but we're also using education and job fairs and trying to help people who have barriers to employment find employment. So we're kind of looking at it from not just making sure that we're getting that money, but also making sure that both parents are being treated fairly so that the child has the best outcome.
I think that's a great outline of how our system is working. And that's a challenging program. And I'm not alarmed at the number. I think Sabrina was her name, of the comments, because it's not a very complimentary challenge between caseload and thanks, Chad.
Welcome.
Tanya?
Okay, so I'm up here for the division strategic plan update. And what I can tell you about that is that it has not been on our top priority list during the pandemic. So, it is, as things start to settle down a little bit, we'll be able to get back into our strategic planning. And now with Jean on board, I think, we're heading in the right direction. So we'll be able to bring you updates as we hear them, or as we start working
That
on it
would be
again.
number 9 then.
Yep, correct. Yep. And then number 10, I'm going to turn it over to Jean to give the COVID-19 update. And you guys remember, Jean's our new health officer, correct? Jean Schultz.
Yes.
She's been on board for 2 months.
Yes.
Yeah. So we've been baptizing her accordingly.
So pretty much the big update this morning is the J&J announcement that the Johnson & Johnson vaccine has been put on pause by the CDC. The state notified us as well that starting today, no more Johnson & Johnson vaccine can be administered until there's more research done. So what happened is I just got the talking points, so I'm going to read off my phone. There's been 6.8 million doses of Johnson & Johnson vaccine administered in the United States. Out of those 6.8, there has been 6 reported cases of rare and severe type of blood clots in individuals after receiving the J&J vaccine. So again, just to stress that this is a rare occurrence that is happening, but it's enough to put a pause to reevaluate to make sure that there is no additional harm. So these symptoms do occur about 7 to 13 days after vaccination. So what we're going to be working on the health department today is to sending out notification to the people who got vaccinated the last 2 weeks about Johnson & Johnson to let us know if there's any adverse reactions, if you develop these symptoms of having trouble breathing, go get emergency treatment. So with those 6 cases right now, 1 person has unfortunately passed away. So they're just looking at if there is a long-term correlation. So that's as far as I know about Johnson & Johnson right now, but we will be taking action to letting our people who have received it, and then also just submitting a health advisory to let people know that this is going on with Johnson & Johnson.
The vaccine is actually just on hold. There isn't any destruction or loss of vaccine.
Yeah, it's just on hold. So we were just notified to keep it stored at the refrigerated temperature. So everybody's just putting it in the refrigerator. No one will be administering it this week. Our other local health departments had to cancel some of their Johnson & Johnson for this week. Unfortunately, we didn't book any Johnson & Johnson this week. So that worked out in our favor that we do still have Moderna available and slots available for tomorrow. If you know anybody who needs a vaccine, head to our website. And then just case-wise, we have seen an uptick in cases over the weekend. We did from Saturday to Monday morning, we had 27 positive cases of COVID come in. We only had 2 this morning. So just talking with our contact tracers, it's more due to spring break traveling, that some of these people who have yet to have a vaccine have traveled and now have come in contact with COVID. So along with our health advisory about J&J, I'm also going to be talking about the importance of doing good social distancing, staying home when you are sick, just all of our normal safety precautions. And then also we did have a case, 1 case of someone who tested positive for COVID after receiving the vaccine. So also just make people aware that just because you haven't been vaccinated, there's still a potential for you to contract COVID, but your symptoms may be less. So it's not as severe. So just making sure everybody has the most accurate, up-to-date information. So like I said, that health advisory should be going out tomorrow. I blocked off my afternoon to work on proper messaging with all the new developments with J&J. So we'll do the health advisory. It'll be emailed out to our partners, local partners, the hospital systems, schools I'd like to connect with, and then putting it on our Facebook and website pages.
And just a note, we administered about 1,000 doses of J&J last week. It was our first batch of J&J in county. And like Jean said, luckily we had other plans for the J&J that's sitting in the fridge right now.
So you don't have to worry about canceling any appointments. So we just had Moderna available this week.
Do we have anybody hospitalized that's positive?
There's the one individual who has been vaccinated who's hospitalized. I don't know what our
Out of the,
hospitalization numbers are.
for Polk County specifically, I don't have that data, but I do know regionally that there are an uptake of surges in our hospital system. So our ICU beds are getting, there's less available. So we do have that concern that there is new variants coming out, that we are seeing an uptake of cases.
And I watched the Minnesota hospital bed capacity because a lot of our patients go over to Minnesota, and you notice with Minnesota is catching up to us quite quickly in their cases. So they've got more spike than we do right now in positive cases. I think they're only 104,000 behind us, where there used to be a couple 100,000 gap between the numbers of positives.
So in this case that had the vaccine, then tested positive, can you tell me the time frame? Was that a fully immune person, 2 shots and then 2 weeks?
Yes, it
It was like they were 2 weeks immune and then exposed a month or 3 later. Got it.
The individual was fully vaccinated, considered fully vaccinated in February. So he had the 90-day immunity window. But what we tell people when they go through the line is that, like Jean said, it's not 100% coverage. I mean, Moderna is and Pfizer are very effective. However, there still is a chance you can contract it.
Do we have any, I know I always bug you with this question, but do we have any variant information about Polk County, whether it's here and which ones?
I do not know for Polk County, but it was,
I don't think there's any.
there was one in St. Croix County that I just was notified. So I was going to share that information as well about the new variant. It's just very hard that the state doesn't automatically want to test for that variant because it's very time consuming and they're focusing on other things. So if we do want to have a variant tested, we really have to encourage the state to do it. So I just know about the one.
I can speak a little bit to the B117 variant to tell you that it's close. We have a current outbreak of that variant in the Cumberland School District, which is just right next door to Polk County. So we do have the variant locally, and it is spreading fairly quickly.
Total fatality this morning on TV was 2 in Wisconsin and 3. Thanks for your presentation. We appreciate that. Very important to have the update.
Okay.
Number 11, CAFO, I don't actually know how that got on the agenda or what.
Well, I know how it got on there, so I just want to talk just a minute on that.
Yeah.
It's on our work plan. Do you want me to remove it from the work plan? So it will show up until we take it off the work plan.
I'm going to give you a quick update on my March 18th steering committee. Some county had they had introduced a 2-year moratorium to our state legislature, and there was quite a bit of discussion, I suppose about an hour, and that got voted, got defeated. And so because there's, at the same time, when they're trying to limit some of these CAFOs, there's some things that we are really would defeating the purposes of our existing large farmers. And so there was a lot of discussion, and so that's where that stood.
Okay. So at this time, we don't know of any conditional use permits being received in county. Would you like me to keep it on agenda on the work plan, or should we just table it unless something?
Well, I think we've had our speakers, and it'll always be there for us to bring up, but I think we've got so many presentations, I think things that are important that I think we can put those things on some of the other things.
Yeah, I mean, I don't feel like it's something that we should put away and not look at and revisit somewhat regularly. I mean, I lost the vote on this. I felt like this committee still should be working on the operations ordinance because it is a health and safety issue. So I don't really want to see it go away. I don't really know what that exactly means. If we take it off your work plan, I think it should stay in some sort of suspended animation.
Bob, you're always going to be bringing things into your office as far as updates and things around the state. And when you see something that needs to be, bring it up to the agenda and move forward. Okay, Tanya.
Okay, and so the same applies for the nuisance human health hazard ordinance. We are still working on updating the human health hazard portion of that.
Yeah, most of those things are a work in progress.
Right, so we were asked to put it on the work plan for the rest of the year. Would you like me to do the same as the CAFO
Yeah.
as needed? We'll bring it back to
We'll
agenda.
work with Bob's office on
Okay.
that. And move
Okay,
forward.
perfect. Is everybody in agreement with that? Okay with that? So the next up is a legislative event report from Chair Bonaprise, and they have not been holding those down in St. Croix County.
We had, just for the rest of the people on the committee, what was always so personal to us was every 3 months, every quarterly, we had the representatives. Last year was Bob Staff and Shockner, so we haven't met the new representatives this year. Bob Staff was moved up to a senator, but with the COVID, we haven't had those at St. Croix County and Richmond. But I've been in touch with both Guy yesterday and Bob. They're gone down to the legislative meetings today, and we're hoping that probably in June we can get that established again, because there's certainly some things that are on the governor's agenda that are just really pertinent to what our operations are in Polk County here. As far as the legislative agenda, on our county steering, Wisconsin County Steering Committee, we went through each item of the budget. It took about 4.5 hours. There is really, and I think Tanya, you'll see some things that in his budget would really make you smile, but we gotta admit, we've got an extremely conservative legislature in Wisconsin. Just to give you one example, like last year when we went down to a legislative meeting down at
the Capitol.
Down at Madison at the Capitol, we came out of there in child support. I believe they were at 15 million in the budget, and after our meeting, they kicked that up to 30 million that we needed in child support. And our Senate and Assembly, they trashed it altogether. And now I believe in the governor's budget, isn't he at 120 million?
That's being debated. So I will bring a state budget update regarding human services and public
And
health.
I think we're
next
going to be
month.
pretty well off on that figure this year, because the legislature in that committee, they did get enough heat that, hey, you trashed that, and it was just a tragedy. So I'm guessing we're probably going to end up with around 60 million. And I got that from some pretty good sources.
Yeah, so the Human Services Day at the Capitol is actually being held today, right now, during this meeting.
Yes.
We did our listening sessions with our representatives yesterday, so the Human Services Directors got together and did it virtually. So I'll be able to bring back more information next month as far as what is happening with.
That was just one of about, I picked out and made notes of about half a dozen things. That was a pretty good sizable increase for our Polk County. And like I say, the governor's budget is a wish list by the time the legislative body has. So that's what I can tell you on that. Moving on.
Okay, moving on. So this is the presentation that we were asked to provide to you. It's kind of part of a series, which we say, Chad. Chair Nelson had asked for some information on the meth cost in the county and the impact that it has, more specifically on law enforcement and our department.
Yeah,
The two highlights, I don't know if you want to.
the request from the executive committee was, you know, to keep the first two priorities of the board, substance abuse prevention and reduction and public safety, you know, in your guys' sites, and then keep you updated. So what we did is come up with a programmatic presentation where we presented to each committee their discipline areas, and then we'll do a comprehensive presentation. So this is specific to the area of methamphetamine as it affects what you guys cover.
Right, so this will be, we'll parse this out into our three different departments within the division. I'll call on the subject matter experts as necessary. Jean and I will tag team because she's obviously been with a few other things right now. So we'll go ahead and next slide. So I always like to start out with our mission, our vision, and our core values. It's just a good reminder of who we are and why we're here. Next one. Some branding things that with our current logos, if you see them, that's connects all back to us here at the division. And then, so back in 2018, the initiative, there was an initiative to, I believe it was to build a meth house, treatment facility in the county, because back in 2018 is when the meth, I think it was probably at the all-time high. At least it seemed like it at that time. So there was a resolution that was brought forward to build that treatment facility. We were then able to put our subject matter expertise on to that resolution and actually have it changed to the resolution 6118, which was to develop programming addressing methamphetamine abuse issues, rather than based on what we knew about treatment facilities for meth, is that they have to stay in that facility for a really long time because the meth needs to clear the brain and before they can even start responding to treatment. So more intensive community services is what is more successful as far as treating meth. Am I correct in that, Lisa? She's the subject matter expert who I'm, go back. Also just put some bold here. So we also did the 60-18, which was bringing the CJCC in-house. So we now have CJCC as part of Polk County operations. Okay, so starting out with Department of Children and Families, the cost, can you guys see the numbers on the screen well enough? Does Chad need to make those a little bit bigger? Okay, so go back to that money one. So what we did here, we did a lot of dissecting of expenditures. So these are just expenditures since 2017. So we have 2017, 2018, 19, and 20. And it's regarding Department of Children and Families and Youth Justice placement. So this is just our placement cost. The green bar is we could link that back to mental health diagnoses. The gray is more linked back to substance use. And how we came up with that is that Lee, who is our subject matter expert for DCF, Department of Children and Families, based on youth justice and child welfare, the types of court orders and placements we're having, we could determine which were driven by a mental health issue and which were driven by more of a substance use. The substance use ones are primarily parents who have substance use issues and can't care for their kids. Okay, so like you'll see in 2017, we had kids in care, $663,000 because parents couldn't care for, or a caregiver couldn't care for their child. And we had to remove them and put them in foster care or some other safe living situation. The mental health is more driven to that youth justice, more residential type of care, more institutional care, if you will. So that's where those numbers come from. So what we saw in 2017, our youth justice, we had a lot of kids in institutions. Also a lot of kids in foster care, a little bit lower in 2018. The substance use kind of rose a little bit in 2018. And that was our, like I said, that was our weird year where everything was off the charts and we saw those resolutions coming. So it all kind of ties together. And then 19, we saw a decrease in the mental health. So less institutional care, more foster care though. So that speaks to substance use on the caregiver part. And then last year, well, first of all, it was just a weird year altogether with the pandemic, but we also saw a pretty significant decrease in the number of placements for mental health related issues. And then the substance use, it did go down a little bit. So we next slide is turn it over to Lee to talk about how we're hypothesizing, making assumptions, and what our response is.
I want to start, I did the last 2 years, I got lots of notes. The reporting for our reports coming into child protection access haven't decreased. Like the amount of reports the last 2 years are pretty significant. They're not significant, the same. And the amount of times that we're going out and working with a family, removing family, those numbers have been pretty consistent the last 2 years. What we've been doing more in DCF is, Marissa talked about that, the CCS program and the CLTS, those keeping families together in the community, keeping children in their home, and then getting community supports in there. That's been a big piece as to why families are staying together. Also, we last year we had hired more social workers. So our social workers are having maybe a smaller caseload and meeting face to face with those families more and coming up with those safety plans. States from the funds from the state to get services, short-term intensive services in the home for 60 days to be able to keep those kids in the home. So we're doing a lot of that. I think my staff is probably really getting sick and tired of me coining the term relational supervision, but that's my new term down in DCF, and that's going to be our way of practicing. So we want those social workers out working with the family. We want that teaming model that Marissa talked about earlier, that philosophy where everyone's got the same voice on the team. Parents are on that team, children are on that team. We're working together. We're not all on separate islands. We're all at the same table. We're coming together. We're building that relationship. And what we're finding is that connection to informal supports lasts, right? So that team, those parents, those kids are going to keep those supports, and we're going to get out of their life. Those kids are going to return home. Those parents are going to be able to keep their children safe in their home, their recovery program. We talk about ACEs. Okay, so what we found is currently we have 34 cases on the youth justice caseload. So those are kids that are coming in for, the majority of them are delinquencies or crimes, and they're on a formal petition through the courts, or they're on an informal agreement with us called a deferred prosecution agreement. Of those 38 cases, we did an ACE score. Is everyone familiar with ACEs here, adverse childhood experiences?
A couple of things that happen to you when you're young, score of 1 to 10, kind of determines a path for you.
So you get a 1, it's 10 questions, and it's traumatic events that have happened under the age of 18. Of our 34 cases, our average ACE score for our youth justice kiddos, that's anywhere from ages 10 to 17, our average score is 4. So the average ACE score is 4. 100% of our kids on our caseload have at least one traumatic event, right? Half of them, 47% of them, have 4 or more ACEs. So the reason why this is important, because what we know about ACEs in the ACE study is that half of these kids, 47% of our kiddos, they're going to be 10 times more likely to inject drugs as an adult in their future. They're 4 times more likely to suffer from health conditions like bronchitis. They're 12 times more likely to have attempted suicide. So if we can take these kiddos and kind of play out what could happen, right? What we're really working on in the youth justice unit is building those resiliency factors. That's that connection with an adult, connection with the community, getting the recovery, working with their CCS, CLTS plan like Marissa had talked about. Because just because they have those ACE numbers doesn't mean that's going to happen, right? But it's our job in DCF to make sure that we're also providing those resiliency factors for the kids. So if we kind of back that up to child protection, the amount of kids that we have in placement right now, those kids, whether they're a week old or they're 3 years old, most of our kids on our child protection caseload right now, I would say have at least 2 ACEs already, right? So they've been removed from their home and their parents have a substance use problem. I think 88% of our children right now placed outside of the home is because of AODA. The family. Majority of those cases are meth, and then it goes to cocaine, 3 alcohol, prescription drugs. Of the 38 families that we're working with in child protection, so that's 38 families, which means 74 kids, only 5 of those cases have no AODA concerns. So those are going to be your families where maybe it's sexual abuse or mental health, parents' mental health poses a safety concern. A lot of information. Any questions on any of that?
Let's talk about some of our responses too, knowing that we have these higher ACEs scores, substance use is a problem. So how are we responding as an organization? You did hit on that a little bit, but.
So strengthening families and systems, SFS, I don't know if anyone is familiar with that in the county, but that is it's a training, it's an education that Polk County offers twice a year, and anyone's welcome to go to it. And that is working with children or anyone in the community that has experienced any trauma in their lives and how to interact with those kids, how to interact with those adults, how to caregive for those kids. And so we've been doing that for 6 years. It offers a lot of support to those families. It offers a lot of support to those parents, and also our foster parents take this class too, because it gives them the guidance they need to care for these kids and also offers them the support they need. We've had school personnel take it. I encourage everyone to take it.
Yeah,
Everyone
you wanna
wants to
take it, we have one
We all
coming
come in contact with people that have experienced trauma. So it's just being very trauma responsive. How to look at behaviors in a different way and react differently. And then teaching other people to do that as well. If you're trauma responsive, sometimes you can decrease kind of that crisis situation, which then is right, or a need to get out of the home, or a need maybe for a parent to not harm their child. Parents as Teachers curriculum is a curriculum that we invested in the Department of Children and Families. This is an evidence-based curriculum. Talks about it's for home visitors, so for our 4 family support workers that are out in the home working with those parents that their children have been removed. So it's working this curriculum in for the parents. So when they're having those visits with their children, they're using some of that stuff that they learned through this curriculum. And then also when the children hopefully will be reunified with them, they continue to use that. So this is for our court order cases, and we also have voluntary cases in the family support unit too, where you don't have to be on a court order with us or an informal agreement. We have a voluntary program where we have a home visitor that can just offer support in this. Not involved in child protection, which is I talked about the stronger social work presence upon initial contact with the department. That's that relational supervision that I'm really pointing the term and driving that one home to all the workers. But this is just going out and making a connection with our kiddos in the county. Going out and making a connection with the parents, offering them support. Of course, we're still going to be holding them accountable and the parents accountable and making sure that safety is occurring, but we also need to build that relationship and that connection, and then finding others that can do that in the community as well. Mentoring programs, things like that. And then the Tssf funding, that is new to us last year for Polk County. That's something that the state brought out. We applied for it, we got it. We actually maxed out our money. We're doing, I think, a phenomenal job of it. But this is so that short-term intensive, we're getting parents into the home once a week to do parent education. We're doing biotech, drug screenings more, getting them involved in mental health. If there's reasons, if safety is a concern in the home, it's what resources can we put into that home to keep the child in the home, right? So they're not being removed, that family isn't being split apart. We've done anything from state, there's limited funds and time limited funds and unlimited funds for if their house is a mess and that's the safety concern, we can hire a company to go in and clean that apartment. If they're getting evicted and that's the safety concern, if they're going to be homeless, then these funds would allow us to pay rent. Short.
I think we're one of the only counties who really use that. There's a few in the state, but we took it and ran with it, and it's been successful. Yeah. All right. Okay, so youth, is there anything that we need to hit on with youth justice? I think you talked about most of that.
What else we're doing as far as youth justice placements is when a child goes into a placement and they're there for, in my opinion, longer than 3, 4, 6 months, we're not doing that child any favors by keeping them in that residential facility. I'm sure you all heard the term institutionalized. So as soon as a kid is going into placement, I want my workers to start talking about discharge planning. What is that going to look like? How are we going to get this kiddo back into the community, back in the family, back in public school system, things like that. So that's something that we're really working on, is trying to get, before the placement, trying to get community resources to keep them at home. But once we'll have placements, that's just something that will always happen. But once that child's in placement, what does this child need to do? What does this family need to do to get out of placement?
And I think Leah's done a really good job at holding the facility accountable to be keeping us up to date on their progress. And if it's not working, we're coming up with different goals and figuring it out so they don't end up sitting there for way too long, just being institutionalized.
Yeah, Marissa, we work closely with Marissa's team, those social workers that she talked about, for when the child does return home, to get on that CCS, CLTS program, so we can get a bunch of those community services into the home to keep it there.
So with that, I think everything that Lee just talked about is why we're starting to see those numbers go down. I think they're doing a fantastic job of keeping kids in the community intact in their homes, and I think we're starting to see that on our numbers. It's not scientific yet, but it's a good indication for us. They're doing a fabulous job.
I think it's another indication of the teamwork in your department. And I want to thank you for your dedication in your department. Bill, I don't want to get off our agenda, but being a county administrator, or being a former superintendent, you can tell me if you can answer this in any way, but you heard her speak of future concerns, of these kids here. And it seems as though every morning on the radio or TV or something, we hear there were some school shootings or altercations of some sort. And I think at one of our meetings, I think it was at a public session on Tuesday, something was mentioned about a disturbance. I think it was a Unity child had a disturbance. So looking at division and your experience as administrator, what's your outlook on protection for the rest of the community?
Well, a couple of different things. First of all, I appreciate all the stuff that Lee does. I've known Lee for an awful long time, and working with her has always been a pleasure, because I think the things that you try to do are community related. And I think one of the phrases that wasn't used this morning is that wraparound program. When you talk about wraparound, you're talking about all the different agencies and groups that work together with families. One of the things that Unity is currently doing right now with their counselors and with Rachel Anderson, who is the social worker there, is they have something that's called a closed gap program. And the closed gap program is a curriculum which K-12 students use, and it can be used on a daily basis. And what they do is it's mental health related. Kids come in, they ask, they go right online on their laptops and their iPads, and they can say, how was your day? 10 questions. Basic questions. Anything traumatic happen? How's your family members? How's your brothers and sisters? Just 10 basic questions. And from that, those responses, the counselors, the social worker, the administration, and even the classroom teachers can take a look at a child and say, much like Lee said, if there are 4 traumatic experiences that have happened to a kid over a week or even one, those people that are related to that student can get on that right now. There's a response to that they can go sit down with a child or get a group together and do, I hate to say group therapy, but you're doing almost like a wraparound program with a whole group of kids. So I know that that's new. They've just put it into effect in the last year, and it's working. And I'm hoping that more school districts will pick up on that. I will tell you that counselors are not sitting in their offices. They're running in the building from kid to kid, and there's nothing wrong with that. It's much easier to make contact with kids in a classroom, in a hallway, any place other than in an office, because sometimes coming into an office is a traumatic experience. Been there, done that. Would much rather meet with a kid out in the hallway than I would sitting in my office. There's a stigma that goes with that. And again, Lee, where would you rather meet with a kid? In the courtroom in front of a judge or?
In the car. They talk so much in the
Yeah.
car, right? It's that informal, not having to make eye contact with them.
Absolutely, absolutely. So I think, John, in answering your question, yeah, there's a lot of things that are happening. And I think one of the positive things that has come out of the COVID is that you're seeing more stress-related mental health issues that schools and counselors are addressing with families, which helps an awful lot. So again, I appreciate, the work that she's doing with her workers, because I see that on a daily
That's
basis.
exactly the point of when she said, we're looking at the vision on this, because it's the things that could happen. And this gives an answer to, yes, there is, we're looking at the cause and the concern and
It's, from a mental health issue, it's a preventive measure. And you're trying to get it before it gets to be the problematic thing. I think, and I say this with my tongue in my cheek, after 52 years of officiating football and basketball and all the rest of the sports, I've learned a long time ago that preventive officiating goes a long way compared to just looking at a rule and say, don't do that again.
exactly.
So if you can prevent that from happening and explain to somebody why they shouldn't do that, that will go a long way.
Dr. Loggins, you're a professional and you deal with mental health. And they're coming, to school and that with some mental problems, some of these.
Yeah.
Did you have any comments on mental health aspect?
Well, I'm very impressed by all the various new developments and programs. I use some of this, not to try to use force. Resources will learn those, but de-escalate.
I had a comment too, regarding that basis form. That would be an excellent thing to have available in clinics, in hospitals, for be aware of in terms of their assessment tools. I'd like
A copy of the actual ACEs, the questionnaire.
As well as the courses that twice a year, that you refer to, that anyone could take. Just have that be a good thing for them.
Yeah. So I have a pretty big list of it. It goes out to the communities, and I'm hoping that once I send it out to, 100 people, I think I sent it out to, they're again forwarding on, but I think we forwarded out to the board members, flyer. Yeah, we're starting our next round April 28th. Because of COVID, we're limiting our size to 15, which is half the size. We usually can run 30, but because of COVID, we want to social distance. We'll have 15 participants. No, I have not developed.
I'm telling you, you have a lot of handouts and information. So feel free to talk to Tanya about some things, because everything we can do is, this is what I appreciate about our committee. We come here and it's just not what's on our agenda here. It's each one of us having the vision of different situations and some ideas that we keep thinking about that we can help somebody or something.
Oh,
I have a quick question.
Thank you all for that.
answer your question, I think there would be a really good opportunity whenever we have less of a COVID problem or start a class online. Social worker in your family, because I'm sure there's people out there who maybe don't have obvious substance abuse problem, but they want to know how to deal with their kids better than they are before they get into your system. And I think that if we might offer some of this online, you might be surprised what kind of turnout you have. Because I did a program in dermatology in December online, and there were 300 people, 400 people from all over the United States who were on that Zoom call for 8 hours a day for 3 days. And so it's crazy what interest there is in some of these issues.
It made you feel pretty good that you got the people's attention.
Yeah.
So I can't think of the name of the group, but the Milltown Women's
CRA.
Chapter. Yes, CRA. Is there any iterative resource back and forth with them?
Yeah, we work very closely with CRA as far as, getting women or children or even men that are in a domestic violence situation currently, getting them the safety there, enrolled there. But they have a lot of outreach programs as well. We've had a few of the employees at CRA go through the SFS training because, for the women and the children and the people that they're working with too. So they've gone through that training. But we work very closely with them. They're a great resource for us.
You want to address number 15?
Well, we're not quite done with this one yet.
Oh.
So Lisa's been waiting patiently in the wing. So we talked about the one department, which is Department of Children and Families, and now we have our next subject matter expert is Lisa Levasseur, who's the director of the Behavioral Health Department. So her slides are more geared toward the behavioral health services that we provide. Take it away, Lisa.
All right, thank you, Tanya. So my name is Lisa Levasseur. I am the Behavioral Health Director. I've been with Polk County just about 4 years, end of this month. So kind of talk a little bit about diagnoses that we have within the behavioral health world, right? Mental health and substance use. And this may be a simplistic way to break it down, but I find for me, it helps me to understand how co-occurring disorders occur as well as just single disorders. So if you look at our little emojis there, so some of the diagnoses, mental health and substance use are linked to emotions. They could be linked to behavior. They could be linked to cognitive functioning and also to physical health. So some examples of that. So with regard to our emojis and our emotions, things like depression, anxiety, post-traumatic stress, which we've heard a lot today. So that's part of that is those ACEs scores. Behavior would be things like substance abuse and or use. Also like eating disorders. So they're kind of more related to behaviors. And again, there's nothing preventing there from these crossing over, right? So those occurring things. And then also with regard to cognitive, we're talking about like chronic mental illness, schizophrenia, and those kinds of things. As far as physical health, we look at things like sexual disorders or sleeping disorders. Questions about that?
Okay, yeah, so what we did similar to Lee's slide on the expenses piece, because there was a request about what our expenditures are. So what we did was took just our behavioral health clinic portion only. We have lots of other services provided in behavioral health, but This is for therapy services only, so our substance abuse and our mental health therapy. The green is the substance use cost, and that those numbers are based on what it costs us for salary and benefits for our substance use clinicians. Actually, they're all dual certified, so they're all in one, and it's based on primary diagnosis. So Lisa will talk a little bit about co-occurring diagnoses, but this is just pulled from if substance use is your number one reason why you're coming to our clinic, $345,000 in 2019 and $220,000 in 2020. The gray bar is primary diagnosis of a mental health disorder, $559,000 in 2019 and $465,000 in 2020. Okay, next slide, please.
Let's talk a little bit about the clinician services within the clinic and looking at visits that are primary substance use or primary mental health. So when an individual comes in our door, it's really a why here, why now. We are here to address the problem that brought them in the door. So a person may come in the door with a mental health issue, but we find out later on it's related to substance use or vice versa. And so if you can look here, you can see the percentage rates. So 52% of mental health, 48 of substance use, 62 of mental health, and 38 of substance use. 2019 and 2020. Yes. And so what that speaks really to is that co-occurring piece. So kind of the what came first, the chicken or the egg. Okay, did the individual start drinking because they are depressed, or they're anxious, or maybe they have high ACEs scores, or perhaps did they were they having a major depression, and so they were medicating themselves with alcohol and or substances for that. So co-occurring, that's what we're talking about with that. So and also people with mental illness are more likely to experience substance use issues just based on their mental illness. And according to the Substance Use and Mental Health Administration, this is a 2018 number, which is a bit old, but that's how most of that information is gathered, is old. But 9.2 million people in the US have a co-occurring disorder. That means they have both mental health and substance use. So now let's take a look at psychiatric services. So as you know, we provide psychiatry services in the clinic, but we also provide them in the jail. We'll talk about that in a little bit. You can see that substance use was very low in percentage for working with psychiatry. And that doesn't surprise me overly much, because mostly we're looking at what kind of medications can we help to address that mental illness, their depression, their anxiety, those kinds of things, right? It is interesting that 70% of the inmates that we saw at the Polk County Jail had a primary diagnosis of substance use versus mental health. So let's look at the top diagnoses here. So these are the top diagnoses for substance use in 2019 and 2020. Alcohol use disorders are the primary both years. And I have a bar here, and the reason I want to point that out is that alcohol use was nearly 2 times more than the second diagnosis, which is stimulant.
A quick question, which category does meth fit into, the stimulants?
Correct. Methamphetamine is the stimulant use disorder. Now, you have to understand that there is no true meth diagnosis, okay? It's all stimulant use disorder. So it could be methamphetamine, could be cocaine. It could be a prescribed ADHD drug, okay? So Ritalin, Adderall, those kinds of things. So it could be any of those. And then cannabis, and then opioid disorders. Okay? So again, I just think it's important to be thinking about, you know, we talk about gateway drugs, drinking, smoking, and those kinds of things, how they lead into other things. So alcohol use is still, for us, primarily the diagnosis we're seeing coming through. Okay, for mental health services, again, 19 and 20, anxiety disorders, depression, PTSD, those are our top numbers. And again, nearly double what the mood disorders folks are. So those are like your then it falls into alcohol use. And then thirdly was cannabis and or stimulant. Help you out there. All right. And so if we look at kind of the assumptions, if you will, questions we ask is, are we adequately addressing our ACEs scores? Absolutely, that's a piece of our evaluation process in any evaluation we do in the clinic. But do we need to pay more attention to that? We need to be doing that in a more formal way. The majority of our services are involuntary. Now that might surprise you, but a lot of our referrals come from probation and parole, they come from jail, they come from CPS. And these folks are in a situation where they have maybe lost their children and they then have to go in, have this evaluation. So that makes us question, what is their readiness for change? Because we know that if you're not ready to make a change in your life, you're not going to make it. And so how do we help prepare those folks to be more ready? And then we talk about some of the generational needs of our community. And this has been a conversation a lot in the department and at the national level is, how are we meeting the needs of our elderly population? Because obviously, when you look at therapy services or substance use treatment, what an individual who is in their 50s, 60s, 70s is going to be really different than somebody who's in their 20s and 30s. And how do we meet that? And then the other thing we talked about was seasonal patterns, and we see this. It's like January is kind of limbo. February, we'll see our numbers rise as far as people in for inpatient stays or having more acute illnesses. That kind of goes over March and April. Everybody seems to be really healthy in the summertime for the most part. And then September, get that anxiety of school starting back, winter's on its way, and it just kind of creeps up, and then hands off into December. One of the things we did notice in 2020 was, and it's anecdotal, a decrease in sobriety and recovery when folks would receive their stimulus check.
So anecdotally, back to Hazelden, they noticed the same thing.
Yep. And we had some consumers say, wow, I just went and bought alcohol, drugs. I had it. So some of the responses. So we've heard a lot today about CCS, Comprehensive Community Services, and I guess the point I want to make with that is truly a program that crosses all of CSD. There are some components of public health that fit into that. Obviously, with Department of Children and Families, we have about 112 consumers in Polk County that are receiving CCS services right now. Actually, we have more adults than kids. Pure CCS, not mine. And our CCS service provider or service facilitators carry a caseload of between 15, 20. Those folks who maybe have a more stable caseload, less acute individuals, might have a little bit more than that. Also, we do provide substance use, mental health, psychiatry services in the clinic. We do provide nursing and psychiatry services at the jail. Our nurse is there once a week, and our psychiatric practitioner is there every other week. And then the questions I have, I guess, is there an additional opportunity to provide more psychiatric services for those individuals with alcohol use? There are medications out there, injectables, Vivitrol, medication-assisted treatment. You'll hear that sometimes. Mostly is related to like opioid disorders, Suboxone kinds of things. Is there an opportunity for us to expand our services at the field? How are we preparing those folks for being sent back out into the community? How are we helping them gain skills to cope with what's going on in their lives day to day, so they don't reuse and then end up back? And then also, we do a lot of partnering with public health. Through some of our grants, we have a lot of evidence-based prevention programs. Some of them, for example, is Bachman parenting skills training, which is also evidence-based. It's a 8-week course where you bring the parents of children in, or middle school part primarily, and you help them with learning the best ways to talk to their kids. It's very interactive. We just received that training in 2020, so we will be rolling out some of those courses this year. Also, we have alcohol compliance checks in the community. So we have a person that has a younger individual who is not of legal age to buy alcohol. They can go into an organization or gas station and try to purchase alcohol. And then we work with that business, if you will, to help educate at a reduced rate than in their fine. We also have the No Meth campaign, and then we also have the Talk They Hear You campaign, which again is related to substance use and mental illness. We had flyers around the county. We had takeout areas would have these little questions, a little card on top of like a pizza box. These are the kind of things you can start asking your kids about to get that conversation. Variety of different things. We have billboards. We have movie ads.
So on this, is there, these two questions, is there opportunity for the alcohol resources in jail? What's the next step on that? Or where's that going?
Oh, well, in this, it actually kind of links back with the work within the CJCC as well, because this is a very important piece of what the work that they do. There's a new CJCC coordinator. She came on in late December and is really just starting to get her feet really into the weeds. And this is something we've talked about a lot, is a jail reentry program, true jail reentry, where let's say an individual has been seeing a clinician in our department, ends up in jail, incarcerated. That a piece of that evaluation when they come in the door is, are you seeing a mental health or a substance use provider? If so, can we contact them so we can continue to receive those services? So that then when they do come out the door, they have skills they've learned while they've been in jail, and they also have a formal connection to somebody outside to continue their recovery.
PJC has a new full-time director now.
Yep. I mean, this
Dr.
it
Bill.
could get big, really. It could get huge if you wanted. It could be therapy. It could be social work inside. It could be, we do some of this already. You know, before individuals are released, and when I say we, I mean community services and economic support, reconnecting folks to getting Medicaid coverage, right? Because it used to be that if you were incarcerated, your Medicaid coverage was gone, canceled. Now it depends. And there's actually some legislation looking at maintaining it for a period of time after incarceration, like up to 3 months, and then also beginning again 3 months before they are discharged from the jail for that community. Because when we provide those services, we aren't getting reimbursed for them. It's about taking care of our community and making sure people have.
Dr. Bill, you got a comment?
Lisa, just a question. I know that the jail is partnering with WITC for their educational programming. Is there anything in there? You know, I was looking up at your board here, and I see the behavioral health response part of it. Is there anything in the WITC programming that they offer educationally that can be tied in with a behavioral response educational programming? I know that not every inmate over there is going to have a high school diploma nor a GED. So whatever you do with the education part, is there something that can be, and I hate to use the word mandated in with the formal book learning to the mental health response?
I don't know that there can be mandated, right? Because services are voluntary, even
Right.
when you're in the jail. But I think it's about, you know, helping those folks gain their confidence in their educational skills and abilities. That helps them then say, I can do things. I can be a better person. I can learn things. And we can bring in groups and individual services. There is a evidence-based practice called moral recognition therapy. It's specifically for individuals who are involved with the criminal justice system. We have a number of staff who were trained on that. That's something we would like to be able to provide as well. And it really is about trying to help people. So if I have a thought and it's in a negative limelight, right? Maybe I want to steal a car or I want to do this or that. Taking and thinking that through and flipping that thought process so they don't.
And to your point, Bill, the way you could mandate it would be much like anger management classes are for DV. It would have to be mandated through the sentencing process of the courts.
Anything else? Try and get close to 12 o'clock.
Yep, we're gonna talk really fast.
This is a kind of a quick one. So as you know, we also do, we are the county's OWI assessing organization. So anytime an individual gets second, third, fourth, is that right, Leah? Second, third, fourth OWI, they have to have an assessment.
Even the first one. Yeah.
And so we are seeing, these are over the years. So in 2015, we've seen 157, 2016, 164. Same thing in 2017, a bump at 18, huge bump in 19, a little bit lower in 2020. And I really think that had a lot to do with pandemic and people not necessarily being out and about. But in the first quarter of this year, we've already done 59 OWI assessments. And if that pattern carries on, we are on target to hit 259 OWIs. That's just us. I mean, there's a whole program that goes with that, right? But I guess I can't stress enough that it's about co-occurring kinds of things, alcohol, mental health, and all the rest of it.
Doesn't say much for the COVID slowdown, does it?
That's cheaper.
Okay. All right. So public health, they are more focused on prevention type programs. So like Lisa said, they partner a lot with the behavioral health clinic. We try to focus on evidence-based programs because, you know, they you actually have proven evidence that what the implementation is effective. So we want to use our money wisely and buy into those type of programs. One thing I'll mention too is every 3 years we have to do a community health improvement plan. Substance use and mental health are #1 on that. I don't know how many years running, but they always reach the top of that list. So some of the responses with public health is that we have the Polk United Coalition. They address it's the top 3, substance use, mental health, and then nutrition and physical activity is the other one for Polk County. Like Lisa said, the No Meth program, Talk They Hear You. The W3TFL is Mary Bow and the tobacco prevention work that she does. We just received the Drug-Free Communities grant. And when does our person start? April 27th, we have the coordinator coming on board. So we will really be ramping Drug-Free Communities programming up in this county. That is a 5-year cycle, up renewable once up to 10 years. So it's amazing to me. I've told you this before. It's amazing that with the issues that we've had in this county that we've never had that grant before, but we're very happy to have that. And then also on the horizon, to tie all of this back to everything that Lee and Lisa talked about, is the Family Connects program. That is another evidence-based program that basically is a home visiting program. They're meeting, our nurses are going out to the hospitals for every live birth in the county, and they either take the services or leave it, but it is evidence-based to prevent the need for child welfare services, behavioral health services down the road. So we feel like that is a really good investment if we can catch them right at the birth, get these moms connected to services, because as we know, like if they can't pay their rent or they need some type of resource, we're going to get them connected right away. And that evidence is behind being able to, so they don't knock on Lee's door and Lisa's door down the road. Okay, and this, I can send you guys this. So of all of these programs and all of the numbers we've given you today, it's really hard to like tease out what's paying for what. So the point of this is that you can't look at it as all of these services are levy funded. We get a portion of levy every year, but we also receive state aids. There's public charge for services. So we charge people to provide services. There's cost sharing involved in that. There's intergovernmental revenue, not much, and other financing sources. So all of our grants, all of our co-pays, all of our revenue when we bill insurance, that's all rolled together to provide the services that we're talking about. And so both for behavioral health and Department of Children and Families and also public health. These are taken right from our budget worksheets. So you should have those in the budget book, I believe. But again, I can send this out if you want to look at it. Those are really small numbers. A lot of different funding sources combined to provide the services. That's it.
Tanya, does Jean have something on number 15 yet?
Well, that's the, so there's a algae bloom issue at
Can I have
Loveless
the
one?
presentation itself, but I can just give you like the cliff note version and then follow up with an email, so if that
Would you
works.
do that, please?
Yeah, I do have Polk in here as well for land and water, so if you do have questions afterward, we can hang out for a couple minutes. But pretty much.
While they're passing that out, I just want to say Lisa and her crew do a fantastic job as well in behavioral health. Jean and public health, it's just really coming all together with this division model that we have. So these are the types of things that we're now seeing made it worth it for us to reorganize into the division model.
Keep going. Thank you, Lisa. I just want another picture. Not that one.
I have no
That
idea.
one. You can stop again.
Did all that here in the county.
That's just the portion of behavioral health.
Yeah, we just want to give you an update. I know last time you guys mentioned the,
We're all.
oh, you can have this.
You know, mine, I would,
Oh, you
might have to.
Yeah, and I'll send this all out as well, but we just want to give you an update that we do have a concern at Loveless Lake. I know you guys mentioned it last meeting, which said I would bring back some information about toxic algae in general. So in the beginning of the presentation, it gives you like how algae forms, why is this toxic, and why is this a problem now? But as you can see on earlier in March, just a couple weeks ago, we had a resident send us this photo to Land and Water from Loveless Lake, and that is our, what is it called?
Link Tolgrex prevents this. It doesn't have a common.
It
so
doesn't
it's
have a
pretty hard to
common name,
pronounce.
but it's part of the blue-green algae family. Even though it's pink purplish, it's part of the blue-green algae, and those are potential toxic producers. So Colton went and got a sample of the algae mat itself and the water, and we sent it to the state lab. The if you can go to the next slide, please. One more. So this is what was found, is that the neurotoxin was detected below the recreational water standard of 8.0, but we still were pretty close at 6.4. But the algae itself is toxic. The results from the lab came back really high, so we are going to be but putting some more health advisories out at Loveless Lake, which is at the last page of the presentation.
You know how many acres, it's right out here in County Road I. You know how many acres it is approximately?
130, 133, maybe. It's close to that.
Go back to this is what we're going to be putting out in like a press release. Everything will be available on our website, especially this presentation, but just talking about don't touch it. If you do, make sure that you wash your hands, shower off the soap right away. Don't swim in it. If you are going to fish in that lake, make sure you only eat the fillets, properly rinse them, and then wash your hands or shower off after you clean your fish. Don't let the dogs drink or swim in this lake just because they can get the little particles of the algae that's currently breaking up with the wave action. And then if they're going to lick their fur, they can ingest it that way and get really sick. Again, wash your hands, and then also wash your pet too if it does go in the water. So we'll be creating some new signage around this for Loveless Lake. We're working with the state on that. And then moving forward, we're going to be looking at just public education for best practices around the lake on properties, and then also doing a couple of water samples just to see like a composite one of the lake to make sure like, what is really going on. But again, that's just a snapshot of that day, so we don't know what long term it's going to look like. And testing is very expensive. So So right now we do have some environmental health funds to cover testing, but it's not enough to do like a full-scale investigation.
One thing I will note about it is this isn't very, not researched too terribly much for this area. So there's not a lot of info on the causes and everything. That's why it's kind of all speculated, but you can see it in the PowerPoint presentation. But something to note is that kind of in our region in northern Minnesota, this exact same bloom happened on lakes there for the first time ever. So just kind of showing that there is change and this does happen in other lakes in our region.
I'm not aware of this happening in Polk County.
Quick question, are we doing any kind of watershed assessment on sourcing and where to start pinning this stuff down and maybe where it's, I mean, it sounds like you're cutting edge on figuring this out.
Yeah, so we already did a watershed assessment this winter. We found a few areas of concern and are looking at doing some cost sharing on some projects there. But a lot of it, we're gonna do more outreach to the Lake Association, hopefully present this at their annual meeting, and then also present a few different programs that can help more of the homeowners on the lake do their own, make a difference themselves. The watershed is 2/3 big. A third of the watershed is the lake, so it's not very big. The watershed itself, and there's not a lot of agriculture in it. There's a very small portion. It's forest. Most of it's just development. So working with those developed sites to reduce nutrients.
Dr. Bill.
Colton, just a couple quick things. Is there water still running from Long Lake over to Loveless?
So no, and I don't think it ever really has surface water wise. And they definitely could be connected through groundwater, but as surface water, I don't think they.
Second point, I know there are a lot of bass tournaments that are on Loveless Lake. And I do know that the DNR is not going to know about those bass tournaments simply because in order to have a permit from the DNR, you need 20 boats or more. And a lot of the bass clubs that come up and fish that lake usually have 19 or under. So and that's normal. And there's if you have a 20 boat bass tournament, you have to pay $25 to the DNR and get your permit. And the reason I know that is I run several of them. Matter of fact, I'm going to pick up a permit for the fisherman's party in Milltown for the one on Bone today. So the question that I have is the homeowners association can't prevent that from going on Loveless. But if you put out some information to people, letting them know that there's that algae bloom and you have motors on boats that are 150 to 250 and they're churning up 15 feet of water, that might be one of the things for the lake homeowners association to know about.
Yeah, and that's all in that.
And I went through that. So that's
Sure, send out the presentation, our joint letter about what's going on and our next steps and these talking points so everybody is aware of what's going on. And if you guys have other people who would like to send this letter to, because right now we're just going to do an email blast, it'll be on our website as well, but just to get information out so people can be.
one of the places that I would post that information is in the bait shops.
Yeah,
Good idea.
I would get that out in the bait shops in the area so that people know that, and I would put that in big letters so that they know that there's an algae bloom and that those large motors would churn those lakes.
Do you have a comment?
The other place would be the other lake associations.
Yeah, I would like to
because
do all of them so
all
we
of
can
them,
touch
because
everybody in the region so they're aware. So it's
they
just not
come
that.
to the lakes.
Yeah, so they
bring-
migrate and then that's another word of mouth. But
Yeah.
we'll look into making some paper signs for bait shops. I think that's a really good.
Joe's a representative to our Polk County part of Cedar Lake, and I used to be. And it's found out they had a problem like this. And it really came from, or most of us think it comes from the surface. They found out it really came from the bottom of the lake. They had
Phosphorus.
Yeah, and it could be that, it could be like more boats turning that up, and it could have just been the right conditions for this to form as well. And like we said, it's all in the presentation of what we're leaning toward, but we don't have any definite answers because it's so new.
I just wanted to make that point that the general public think that this is something that, you know, that came from some process. And they found out it really came from the bottom of the lake through the fish carp and things like that. It's
Yeah, and
really a process of,
Yeah, and our department did do a study out there a handful of years ago, but a person, an alum applicator, would really have to look at the data to determine if it's possible, because if there's too many nutrients coming in from the watershed still, you could do an alum treatment, which is all very expensive, and it won't work. Because if there's too many nutrients coming in, it'll be clear for the summer, and it's just gonna go back to where it was. So kind of an in-depth look at that, and then with Cedar Lake, they found that there is very little nutrients coming into the lake. It's all being released from the sediment.
came from the bottom.
And I have that in the presentation
Yeah,
too,
no,
that it's to look, that there might be an option for Loveless is to pursue it.
And you're going to email this out?
Oh, we'll email it, yes, absolutely. It'll probably be tomorrow. I'll probably just do a joint one with this and all my other.
Other comment, Joe?
Yes, another place to put them are, all the lakes usually have a big bulletin board there. And that's a place, because a lot of people read that before they even go in. For size limits
And
ethical
online.
landings, yeah.
Online is.
So one thing to note too, that I don't know if it's really in the presentation quite yet, is that the landing is posted with water quality warning signs right now. They are just your regular.
This big. I'm
Print
looking
for
to get
paper.
some aluminum ones made with pictures of what this algae looks like and typical blue-green algae, so then we can use it if there's another case of it. But I'm working with the state because they have custom-made signage already, and they're just going to insert our pictures for us. Because I think it's very important that people get that visual behind it, because it's not typically blue-green.
But you never imagined that was part of your job.
I have a background in environmental health, so it's kind of more like slightly biased to me.
Any
so
more
like
quick comments?
Can we just keep this on our agenda for updates as this evolves? I would love to
I
hear
would
how.
like to, once we do, and I'm going to be driving to Milwaukee so I can drop off the samples. Cost and shipping, so you have to overnight them, and it's like $110 per sample. So I'm going to drop them off at the lab, and then I can provide that update as well, what we find of a composite sample or what the DNR asks. I think it's important that they just don't think it's like the boat landing of the lake, that it may be found.
Anything else in your presentation? Okay, thank you so much. Bob, have you got some good news on that grant? And I think,
Partial, Erica just completed
That's
the
interesting.
boards.
I think you're the last on the agenda. I'm sorry we run over here a little bit, but we have a busy day.
You see the best for last?
Yeah, we did.
Nice to see you all again. I am happy to report that we were somewhat successful in receiving some funding for groundwater strategies this year. So Polk County was one of 13 counties that was approved for some funding from the SEG Innovation Grant. And just to report on that a little bit, this is kind of a neat project because we're able to meet some deliverables of our 10-year land and water management plan, get some information out to the public on where their wells are testing with regards to nitrate levels. We'll be able to obtain some pretty valuable information about another one of our watersheds. So going down the list of priority watersheds, since we only have enough funding, we received $10,500. We only have enough funding to perform a study on one watershed. Remember, we were hoping to do 3. But one watershed is good. We have the capacity and staff, and given our summer workload, we'll be able to manage one watershed pretty effectively. So that's okay that for us on our end that we receive funding for one watershed. Going down the list of priority watersheds, I think our number 2 watershed was Horse Lake, Horse Creek.
Yeah.
We've got a lot of activity going down there with the farmer-led watershed, a lot of cover crop installation. So with that activity, I think it's going to be best to go into the Wapagasset watershed with this study. So we'd be looking at that watershed. Part of this grant allows us some incentive dollars to get cover crops on the ground in areas where they're needed to try and prevent nitrate leaching to the soil profile. So we'd be able to expand some best management practices in another area. So just to share that with you, we're hoping the Wapagasset watershed this.
You done?
Yeah. Unless there's questions.
I want to hear from the other supervisors what you guys think of this idea. I think we've got this $10,000, and whether we could go to the board, it would take a 2/3 vote, would do a small budget amendment to ask for a match of 10, and then get another watershed done. So we get 2 of our 3 done, and then ongoing, we build this into the budget that we keep doing another watershed a year, something like that, so that we can kind of keep this rolling since our water testing is so late and I mean so old. So I don't know the mechanics of this, but I wanted to hear what you guys thought, if you felt like there was any appetite for this or.
I guess that's something that I probably should comment on. And the exciting thing, and Eric, we've discussed that, the exciting thing in our area is St. Croix County was one of 3 counties in the state that had a total well sample grant. And so when that's all finalized, I think that's going to have the huge impact of being where, the neighboring county. And so I think the biggest news on the horizon for our up-to-date data is going to be what's coming out of St. Croix County. One thing I want to been pretty persistent on is on our counties association and steering committees. We've really been warned for 2021. Be as conservative as we can be. And we're very lucky with this, $10,000 grant. Something we want to keep on our agenda, want to keep on top of everything. My comment is right now, I hope we can be as conservative as we need to be. Chad, you're our budget person, and we have our budget set for this year and working on next year. You're the people that we got to work with. We can come up with a lot of ideas, but we won't. It's our responsibility to be realistic.
I think one option too, after talking with both HHS and environmental services staff, is given that we got the grant, doesn't cost us anything this year. We feel we can apply for the same grant next year.
Exactly.
And then also
move into another
a
phase.
new budget year, maybe budget, so that the strategy would be do one this year, break, have our staff do that, break us in, then we do 2 next year. Which this was originally planned for several years down the road. So we are moving it up quite a bit. So that's one option. I think would fall within the budget guidelines.
Brad.
I have a comment. I support reapplying for the grant in next year or as many successive years as whatever we would done. As far as the budget amendment goes, I can also see support for that. It has pretty large fund balance. What did you say, like 50?
50.1%.
Yeah, 50% fund balance. And also the county got a lot of money. Was it 8.9 million?
We will receive in total 8.9.
Okay, and I understand that money can't be used for everything, but that money is going to free up other budgetary items where that money can be spent. So, I also don't see that as a huge issue, but I do see more of an issue, and doing another one this year is overloading the staff. I do have some sensitivity to that, what they can comfortably manage doing.
So let's, Eric, put that on the, be one of our main topics on the agenda for our main meeting. We'll talk to some more supervisors, and they'll get to know more about our program now. They really know nothing yet. You'll do the announcing at the county board next Tuesday.
I think our administrator was gonna announce.
Yeah. So we'll have these things on the agenda next meeting. Go forth from there.
Just one last thing. So are you feeling like adding anything this is an overload? I want to be sensitive to the staff, but you guys thought you could do 3, you're doing 1. It sounds like you can do 2, but I don't know if we have the money.
We have one staff person that's on long-term leave this year. It's good news.
Well, the
So
answer is-
our capacity to take on all 3 has changed.
So 1 is more comfortable. Are you
One
saying?
is, yeah, we could do it effectively, for sure. We could probably do 2, but we're very comfortable with doing 1 this. But the timeline is coming up soon. We have to start.
We got a couple agendas and items and anything else, Tanya, that from the committee we want to have on the agenda next month?
I have the Loveless Lake update, water quality study update. Will you guys have it started by then? For the May meeting?
Loveless?
No, or your waffle.
Oh, for the groundwater.
Yep.
We'll probably, I can't do much until we have a contract signed.
Okay.
And yesterday I just did the revised budget. So when we get that, I'm not sure, hopefully in the next week, we may.
We'll bring that if there is relevant information. If there's nothing to report, we won't have it on the agenda. That's all.
You all done, Tanya?
All done.
Okay, and I try and adjourn by usually 12 o'clock, but
Motion to adjourn.
motion made and seconded. Madam Clerk, all in favor, say aye.
Aye.
Have a good spring, everybody, and